Hello, this is Neil Baum from New Orleans, and I want to talk about a ubiquitous problem that is probably very familiar to all urologists, and that is how to manage the chronically late patient. In this video, I'm going to talk about the current situation regarding late patients and a few suggestions for managing that late patient. Every practice has chronically late patients. They create a significant problem with your schedule. It reduces significantly your productivity and produces stress on you and your staff, and it impacts other patients who do arrive on time. I'm suggesting that you create a written policy regarding patients arriving chronically late. Advise patients to arrive a few minutes early before their designated appointment to complete appropriate paperwork, and explain to the patients the impact of a late patient on the doctor and the staff and the problem it creates for patients who are arriving on time. The easiest method, if the patient is chronically late, is to see that patient and move them to the end of the day. And also, you should consider, if a patient is chronically late, to reschedule that patient. If you do either putting them at the end of the day or rescheduling them, they will learn that they have to be on time and that you expect them to be on time. I think it's important to listen to the explanation why patients are late. For example, an older patient might be dependent on a family member for transportation, and arriving on time is out of their control. Patients who are usually on time deserve an occasional allowance for being late and give them some slack if they are mostly on time. You have to set an example. It is important that if you expect patients to be on time, the doctor has to be on time. And it is necessary to create a commitment to your patients and your staff to being an on-time physician. Only then can you request that patients arrive on time. If the doctor is running late, it's a nice courtesy for someone in your practice to go out to the reception area and explain the delay and give them the opportunity of rescheduling, or that they can wait until the doctor arrives. Overbooking is not a solution to managing patients who are chronically late. If you overbook and everyone shows up on time, the result is you will have significant delays in seeing your patients, and you will create a problem with your schedule if you make using overbooking as your attempt to deal with chronically late patients. Charging the chronically late patient or the no-show patient has been tried for decades without success, and it is almost impossible to collect those fees if you try to charge a patient. I'm suggesting that you warn the patient and tell them that if they are chronically late, they will be moved to the end of the schedule. So what's the bottom line? In most urologic practices, we are seeing decreasing in reimbursement, and we're also seeing rising overhead costs. As a result, it is imperative that we become efficient in order to be more productive. This means we cannot allow patients to wreak havoc with our schedule. It creates problems not only for the doctor, but the staff and other patients as well. I believe you can implement a policy regarding lateness, and this may help resolve the problem of the chronically late patient. Well, I hope you have found this video helpful and useful. And if you would like a copy of the slide deck, which I would be happy to share with you, or if you would like a copy of the white paper on dealing with the chronically late patient, contact me at the email address shown on this last slide. Thank you.